Okay, let's move to the first most common of congenital heart disease, which is ventricle septal defect. As you can see here, there's a gap in the ventricle over here, which allow the blood move freely from the right ventricle to the left ventricle, of the left ventricle to the right ventricle. So they will disturb the flow of the oxygen to the body or to the lungs. Okay, let's learn a little bit detail about the ventricle septal defect. Okay, this is the most common type or most common form of congenital heart disease, which around 30 to 35% of congenital heart disease is caused by the ventricle septal defect. So the primary defect is the failure of the formation of the heart that caused from incomplete structure during the development of the heart. As you can see here, the bottom and upper layer of the heart does not close completely. Okay, the superior and inferior portion does not close completely, causing the gap, which the main reason for this disease. So what happens when there's a gap here in ventricle septal defect? So there will be left to right shunt, which is high pressure here, causing the blood to flow toward the low circulation to the right ventricles. So what happens when the oxygenated from the lungs, rather going to the aorta completely, but because of the high pressure over here and there's a gap over here, some of the blood will go back to the lungs. So oxygenated blood from the lungs going back to the lungs, causing an increased pulmonary blood flow and pressure, because a lot of blood is going to the lungs. Smaller ventricle septal defect may be asymptomatic, but larger ventricle septal defects will have much more severe symptoms and present earlier, which need treatment, usually surgery, to close the gap over here. So next is atrial septal defect, stands for ASD, which we can see a gap over here. Remember, we already learned before this that the heart of fetus will have the foramen oval to bypass the oxygenated blood to directly to left ventricles and pump out to the body, since it's not need to go to the lungs to get oxygenated. So the disease caused when the gap over here, the foramen oval, is not closed after the birth. This disease is quite common as well. So almost 10 to 50% of congenital heart defect is caused by atrial septal defect. The pathophysiology is quite similar to ventricle septal defect, which is left to the right shunt of the blood, since this high pressure over the left atrium and left ventricles. So what happens? They will increase pulmonary blood flow, okay, increase blood flow to the lungs and cause the increase cardiac output to the pulmonary circulation. Okay, so the left ventricle the right atrium, the right ventricles will be dilated because lot of blood flow, okay, from the left atrium going to the right side of the hearts. Okay, mainly caused by the gene defects or chromosome abnormalities. So this is another congenital heart disease which called as AVSD, stand for atrioventricular septal defect. As you can see here, there's a big gap over here in the middle which can cause the blood go from the left atrium to, or from the left ventricles to the right atrium and right ventricles. Okay, and the valve here will not function well since this gap over here that can cause the blood to backflow since the gap over here. It's the same pathophysiology with the VSD and ASD, ventricular septal defect and atrial septal defect, which left to the right shunt of the blood. In addition, we have a valve regurgitation. Okay, since there's a gap in the middle, so the blood will backflow from the right ventricles to the right atrium. There is much more significant left to right shunting and cause much more severe pulmonary overcirculation and increase the cardiac output and cardiac pulmonary ratio. So another congenital heart disease called PDA, stand for pattern ductus arteriosus. So which you can see here, is called ductus arteriosus. So let's learn a little bit about it. So what the structure importance? Okay, what the function of ductus arteriosus? So it's a vascular tube connecting the left pulmonary arteries to descending aorta. It's a very important structure in fetal circulation. Okay, since it's no need the blood to go back to the heart, so just it can bypass the heart and straightly to aorta since the blood is already oxygenated. Okay, after birth, the ductus arteriosus mostly closed by the second or third day of the life, okay, and fully seals by 2 or 3 weeks of life. So the disease or disorder occur when the structure is not closed by then. So 10% of congenital heart disease came from the patent ductus arteriosus. It's the most common form of congenital heart disease in premature baby. During the development, ductus arteriosus is kept open by the vasodilator, which is prostaglandin E2. So at birth, the oxygen levels go up and lungs now become the source of the oxygenated blood. Then the prostaglandin falls and cause the ductus arteriosus closes. Okay, and there's another component which released by the lungs, is called bradykinin. So the lungs release the bradykinin to constrict the small muscle wall of the ductus arteriosus and reduce the blood flow as it's narrow and then completely closed. Another type of congenital heart disease called coarctation of the aorta. So what is is it? As you can see in this diagram, you can see a narrowing of aorta. Okay, causes the obstruction to blood flow. So when there's obstruction over here, the blood before the point of coarctation will become very high, and the blood flow or blood pressure beyond point of coarctation become very low. So it occurs most commonly in short segment of the aorta just beyond where the arteries to the head and arms take off. Other than that, congenital heart disease also can cause by the valve, especially aortic valve stenosis. Okay, this refers to a condition that causes the obstruction to the blood flow between the left ventricle and the aorta, caused by the thickened abnormal structure of the valve, which can cause reduced blood flow or reduce the cardiac output or blood pump out from the heart. So we already talked about the acyanotic congenital heart disorder. Now we will talk about the cyanotic congenital heart disease. The most common type is tetralogy of Fallot. Okay, is cause around 5 to 7% of all congenital heart disease. Okay, what is this? It's referred to a combination of 4 related heart defects that commonly occur together, which is ventricle septal defect. So we already learned before this. Second is pulmonary stenosis, which characterized by condition of obstruction to the blood flow from the right ventricles to the pulmonary artery. Okay, this obstruction is caused by narrowing stenosis at one or more points, okay, from the right ventricle to the pulmonary arteries. The third one is right ventricular hypertrophy, which is heart disorder characterized by the thickening of the wall of the right ventricles. Okay, it can be caused by the excessive stress on the right ventricles, maybe the overflow of the blood or the left to the right shunt or any other factors. And also the last one is overriding aorta, which means that artery that carry the high oxygen blood to the body in aorta is out of the place. Okay, instead of should be in left ventricle as in healthy heart, but is arise in above both ventricles, so in the center. So what happened? This allows some blood that is low in oxygen in the right ventricles to flow in the aorta and out to the body instead to the pulmonary arteries, okay, which normally is take to the lungs to pick up oxygen. So now the deoxygenated blood with the oxygen is pumped out from the aorta. So as mentioned before, this is combination of 4 different type of symptom, which narrowing of the pulmonary tract, thickening of wall of right ventricles, ventricle septal defect, and displacement of aorta, is overriding aorta. Okay, now let's look the signs and symptoms for the congenital heart disease. Okay, first, baby with congenital heart failure, they're having a fast breath, okay, and it's quite hard okay, for the babies to take breath. Usually they quite sweat a lot and tire out while feeding because of more energy, more blood need to pump out. Sometimes because of abnormal blood circulation, it grows slowly, or sometimes even lose weight because when there's a disturbance in the blood, the delivery of the blood which carry the nutrients and oxygens to the tissue and muscles. Usually this symptom develop gradually over the first 1 or 2 months of the life. The first thing that we can know whether the baby has a defect or not by listening the heart murmur. Okay, so what's the heart murmur? It's the sound of the blood flow turbulence in the heart, which mainly causes the blood passing from the left ventricle to the right ventricles and out the pulmonary arteries. So usually the heart murmur is often the first clue that the heart defects exist. Actually noted present in the first week or 2 of life. Because there's a high incidence of ASDV or unstable ventricular septal defect in infants with Down syndrome. So all infants with Down syndrome should have an echocardiogram, which is a test that uses high frequency sound waves to make picture of your heart. Okay, so to see whether they have any of the sign or symptom of AVSD. So another symptom that we can look is cyanosis, which the baby skin turn to the blue. Usually we can see in the lips, in the fingers, caused by the blood with low oxygen, okay, to go from the right ventricle to the left ventricle and out to the body without picking up the oxygen in the lungs. So they bypass the lungs and carry the low oxygen blood or deoxygenated blood to the system. Another symptom that we can see is pulmonary edema, which caused by the left-right shunt resulting abnormal pressure in pulmonary arteries because the blood in the left atrium and left ventricle, rather than pump out to the body, is going back to the right ventricles, causing the congestive heart failure. So as you can see in this picture, you can see in the lips, okay, the skin color turn to blue. Okay, sometimes you can see in the fingers, which indicate that the baby having a low oxygen blood in the circulation, does not have enough oxygen and need to be looked immediately and admitted to an ICU.